Well, thank you, Dr. Cohen, for again giving me a stimulating case about something that I had no idea about. So, 73-year-old female, no vision complaints. She has a history of normal tension glaucoma, hyperlipidemia. She had her gallbladder removed. She's on antihistamines, protonics, and fluconazole. Vision good in both eyes, pressure normal, and we're just going to focus on one eye for this case. So you could tell me what you see in the image.
All right, this is a looks like a slit lamp photo of an eye, specifically focusing on the iris. Looks like you can see some blood vessels kind of growing in the stroma and the surface of the iris, and on the edge here in a sectoral pattern. Looks like a little bit of atrophy possibly as well. The conj looks a little hyperemic, maybe like a trace injection.
Yeah, basically it's an iris with blood vessels.
If anybody's starving, I'll have a couple of yogurts. They were supposed to bring food.
So I think that he got referred to evaluate for a possible mass or a melanoma causing the vessels, or that's just
Just because of the
saw these
vessels. No, someone referred to the funny looking vessels.
Okay, so referred for funny looking vessels. So I think Dr. Cohen wanted to make sure there wasn't a melanoma or something back there causing these vessels to grow, right?
Well, you could say like, what would you be worried about?
Okay, yeah. Well, what would you be worried about?
Would you want to do any tests?
Yeah, so
How would you get a better look at the iris?
Yeah, I'd be worried about like either some mass or maybe an ischemic cause, posterior ischemic cause, diabetic retinopathy, or anything else causing ischemia.
What's a good way to get a better look at the iris?
I mean, I already saw the next slide, anterior segment OCT.
Yeah, we'll do
Actually, no, that's UBM. So Colin, I know you're new, you just started. Do you think what do you think those vessels might be? So you were talking about ischemia. It sounds like you're looking at rubiosis.
Yeah.
Are you thinking those might be rubiotic?
Possibly.
Okay, you might not have seen a rubiosis case yet, but so let's say you have iris vessels. One choice would be rubiosis. What might be another choice?
Could it be just like the blood vessels from the iris itself?
Yeah, like regular blood,
atrophy?
just dilated, dilated regular blood vessels. And then I guess if there's some sort of intrinsic tumor, like a vascular tumor of the iris, right? Maybe that makes sense. Rubiotic vessels, when you see them, your senior residents will be able to tell you. They don't look, this is a little different. So this probably is not rubiosis, but just so you know. Okay, go ahead. So that's actually a UBM, ultrasound biomicroscopy. So it's not an OCT, even though it looks like an OCT.
Gotcha. All right.
The OCT get through the stroma. I like anterior segment OCT, but it really doesn't get through the iris very well. It's good for cornea. It doesn't really get through the iris. So this is a cut through that. This is a longitudinal cut through that area.
All right. I don't have much experience interpreting these, but
Yeah, that's okay. You can just say what it looks like.
yeah, so I mean, I see the ciliary body kind of on that lateral portion there, going into the iris. There seems to be some sort of space underneath, and then looks like the arrow is pointing to, I guess, a hyper echoic area there.
Good. Is that one of the spaces with a name?
I'm sure someone named these spaces.
There's burger space. There's a couple spaces. I think that space might have a name, but yeah, that's where you're seeing the front of the lens, the ciliary body, and the iris.
Preciliary spaces, Dr. Cohen.
Yeah, yes, sure. I gotta get my name somewhere. I had a less common name, And then that's a transverse cut through the same area.
Oh, okay. So it looks like it's uneven from one side to the other. Looks like there's more of a space on that left side than the right.
And how about the thickness? The thickness of the iris?
Looks like The iris is a little thicker on the left side over there.
Do you see a tumor in either of these? Like anything
mean,
that looks
I don't know if it's
mass?
possibly like the ciliary. I don't know if that's just the way it's been scanned, but possibly the ciliary body is a little bit larger on that left side than the right. Looks a bit,
If it is, it's not much. Basically in size, your iris, what's your corneal thickness? 500 microns, half a millimeter?
Yeah.
Yeah.
I mean, so you're less than a millimeter. So if there is some thickening, it's probably less than 1/10 of a millimeter. So I wouldn't really, I think this kind of rules out a mass. If you had a tumor that had a feeder vessel, it would be, you'd expect at least a 2 millimeter tumor and probably more like a 4 to 6 millimeter tumor. So I think you could, even though you can't say for sure there's not a, 1 millimeter growth somewhere, I think you can say there's probably not a tumor there.
Okay.
I think.
Yeah, that's pretty much it.
So that's it. So if you go back to the color, so basically it's mostly so there's a vessel there that's funny looking, and there's an ultrasound that shows that there's not a tumor. That's kind of where you're at.
Gotcha. So, I mean, again, differential, was the tumor that she ruled out, and ischemic causes, but and based on your comments, doesn't seem to be the rubeosis type vessels. Could be some elevated episcleral venous pressure due to like a CC fistula or AV malformation. And then possibly just atrophy of the iris due to like post-viral sectoral atrophy, like from VZV or something.
Yeah, if there was sectoral, which it could be, I mean, you could list differentials, but if there's sectoral atrophy, you'd expect your pupil to be abnormal, in that area. And you expect the muscles kind of swirl. They're those radial muscles, because it is nice to look for sectoral atrophy for herpes, herpetic uveitis. And one of the signs is that those radial fibers are no longer radial. There's a word for it, like they swirl or they whirl or they something. But yeah, these are pretty radial still.
So yeah, I had no idea about, I was like, okay, it's either normal or abnormal. That was my classification.
It's one of those things. You'd be surprised. You'd probably see one of these. I probably see one every year or two, and you practice, you'll probably see it. So it's nice just to say, oh, don't worry.
So the differential, could be like a feeder vessel feeding a melanoma. That's one thing you want to rule out with what he did with the UBM. Arterio-venous malformation, a capillary hemangioma, a cavernous hemangioma, a varix, which is just a venous dilation. Neovascularization, like you said, that was pretty much my only differential. And I said, okay, this doesn't look like NV eye. And then you can get stuff from granulomas, which are either infectious or inflammatory. So I just have a bunch of pictures of all these different things, so we can see what they look like. Just a quick review: the vascular supply of the iris, the origin, the anterior and long posterior ciliary branches of the ophthalmic artery. They extend from the insertions of the rectus muscle. They merge at the ciliary body to form a major arterial circle. Those join the anterior and long posterior ciliary branches. Then they enter radially into the iris. They anastomose with veins to form a minor circle. And then they drain via the anterior ciliary vein and the vortex veins. So there's just kind of a picture. You can see the anterior ciliary arteries. They come in with the muscles. There's the major circle, and then they go into the iris, and then there's a minor circle.
You know what? I've had 2 patients in the last couple of years who've had severe trauma, one blunt and one non-blunt, and their irises have totally atrophied. So there must be something about this blood supply that's sensitive. I mean, gone, nothing left. So there's something about the iris blood supply that's a little fragile to trauma. Sorry, guys. Yeah, watershed, or it might be this not redundant enough, or maybe
Iris AVMs. There's a bunch of names: racemose hemangioma, AV aneurysm, chrysoid hemangioma, but these are all kind of misnomers. At least they're not named after anybody that, as far as I know of. They're not neoplasms and they don't have localized dilatations. So technically they're not aneurysms or any kind of an oma. They're just a continuity between the artery and the vein without any intervening capillary bed. That's the definition of an AVM. Benign, stationary, and it's rare. They're usually unilateral. They can be congenital or acquired. They can be part of the syndrome, the Wyburn-Mason syndrome. And then also these AVMs, they're not really completely visualized by a slit lamp. The angiography can be really useful. And you can, Jerry Shields wrote a really good review paper of, I don't know, a couple hundred of these cases, and he looked at all the irises and all the different patterns. They have characteristic fluorescein angiographic features. There's very early intense staining. You can have a simple loop, such as in the middle, or you can have, I'll show you more later, more complex with intertwining vessels. They're usually stable. They don't change in size over time. And like I said, they're uniformly hyperfluorescent in the early phases. They don't leak. Neovascularization has prominent leakage. Do you ever do iris FAs? Does
Almost
anyone
never.
ever do?
You can, they're kind of fun. We have I hope somebody would want, I can't remember why.
It'd be cool
It's
to-
not a common thing.
So I have more pictures of them.
Yeah, they are kind of cool. They're easy to shoot. They're pretty striking. The Heidelberg does a nice job on them. The confocal systems, you get pretty nice iris FAs.
So the top one, you can see the vascular loop, which is kind of similar to the one we had. It starts near the limbus, it goes towards the minor circle, and then it goes backwards, or maybe it's feeding from both.
So which is the
directions.
minor and which is the major circle?
The limbus is the major circle. This is where the anterior ciliary and the long posterior ciliaries join.
Okay.
They enter radially, and then here they anastomose with the veins. And then I guess they go back and then drain to the vortex veins.
Okay.
Actually, I think during angle closure glaucoma, the inner ring becomes ischemic, which is so then you snuff out the pupillary sphincter. That's what folks see after angle closure glaucoma. Sometimes they never actually regain their ability to become myotic again because it was ischemic.
So I think the anterior ciliary come through the muscle, and the long posterior ciliary come through the choroid, and they
Right.
meet here,
Okay.
and then it all drains, I think, through the long posterior, which goes to the vortex veins. And I think this goes through the ciliary body.
Okay. Thanks.
So this is a simple loop. Wait. Yeah, this is a simple loop. That's a simple loop. And this is more of a complex one where they kind of intertwine and intermix. And this one's, you really can't see this one so well on just this lamp photo. You can appreciate a lot more. The differential. So there's just a couple of key findings for each of these. I have a picture of pretty much all of them. So melanoma, you're going to see a solid mass, and you can see a prominent epibulbar vessel, but you can also see like a feeder vessel that's also normal and part of this just range of normal AVMs. You can have an AVM, the capillary hemangioma. It's associated with a diffuse mass with periocular cutaneous capillary hemangioma, and this also regresses. So there'll be capillary cutaneous, there'll be a cutaneous hemangioma near the eye with the vessel. Cavernous hemangioma, there are little grape-like vascular tufts at the pupillary border. This has like a 10% association with myotonic dystrophy, 20% association with diabetes. You may see that on a board question. Varix, a solitary round lesion, involves a vein, and it doesn't have a feeding artery. It's just a dilated vein, just like a varicose vein in your legs. Neovascularization, they're fine and they're diffuse and they leak on FA. And then I have some pictures of some granulomas that have some pretty good vessels. So this is a melanoma. You can see all these kind of fine vasculature, and there's a mass here. And this would probably appear elevated on UBM. Capillary hemangioma, you can see the cutaneous periocular hemangioma here. And then the same infant with the eye, you can see it's kind of diffuse but it's in the same eye with capillary hemangioma. Cavernous hemangioma, there's a bunch of pictures online. This one kind of shows grape-like mass, but it's not super clear. A varix, big dilated vein, this will block on the FA. And then UVM, you'll see this big kind of heterogeneously echoic mass above the iris.
Is that because, why does it block? Is it because?
This is blood. It's dense.
So is it clotted there or it's just?
This is a clot. This varix is a clot in it.
Okay.
How would you differentiate that between that varix and a melanoma? Did you take that out?
Is the fluorescein different?
Yeah.
In the
This
UBM
looks like,
probably looks
this
different.
looks like a clot.
Can you remove that? 'Cause it looks like it's going into the central visual axis a little bit. Did I do it?
It's said, this case, they followed it and it resolved over time. Iris vascularization, rubiosis is fine, lacy, can extend into the angle. If you did a gonio in this person, probably be pretty dramatic.
And it's usually the pictures, rubiosis is very hard to photograph because it's usually so fine. So
Yeah,
generally you see it at the slit lamp. If you can photograph it, it's, end of the world rubiosis.
and a lot of the time it's much more subtle.
Yeah,
Subtle
super
than this.
subtle.
But if they come in with, high eye pressure and they don't have narrow angles and they have the history of diabetes or proliferative diabetic retinopathy, you can really hunt for these vessels and you'll see them. Syphilitic granuloma, so they had a granuloma in the eye and they had some dilated vessels here. And then sarcoid granuloma is also a granuloma, so that can also grow abnormal vessels and it looks like a mass. And here you can even see they have some like mutton fat KPs on the endothelium there.
Are those Berlin nodules? Like, is it, that's inside the eye?
I guess the Kepi's right at the pupil margin, right? And then the
Yeah.
Berlins are supposed to, it probably maybe it's.
It's a granuloma. It's a granulomas,
Yeah.
But yes,
For, like board purposes, like you guys are.
so Kepi is near the margin and Berlin is near the limbus, right?
And the Busaka is in the middle.
Oh, God.
So it's alphabetical, so BR or BE, like Berlin, it's furthest in the periphery, BU, so Busaka's mid iris, and then Kepi is by the iris. Nice, the people in margin.